As Steve Bennett mentioned, obesity can increase the risk of kidney disease. It can also lead to diabetes, heart disease, and high blood pressure. And in the space of a generation, obesity has become epidemic in America and Oklahoma. Kathy Tatum looked into how that happened and what is being done to keep the next generation from suffering the same fate.
Supersizes are back.
The 70s, 80s, and 90s changed America's eating habits. Fast food became more popular. Portions supersized. Consumption of fruits and vegetables fell. Mariana Wetherill is a registered dietitian and assistant professor of research at the OU College of Public Health.
The majority of Oklahomans don't even eat one serving of vegetables or one serving of fruits per day.
At the same time eating habits were changing, technological advances in the workforce and at home led to more sedentary lifestyles. Dr. Lamont Kavanaugh is with the OU School of Community Medicine in Tulsa.
So what we've seen as we start to supersize everything is that we can't keep up from an activity level standpoint to burn all those extra calories that we're taking in.
The Centers for Disease Control will soon publish figures showing 32% of Oklahomans are obese, with no changes in eating or exercise habits.
It's projecting now that by the year 2030, about 2/3 of Oklahomans are going to be obese.
Obesity can be brought down to a pretty simple level of you have to burn more calories than you eat, or if you don't, then you're going to put on weight. So if we're taking in an extra 500 calories every day than what we burn, we will gain on average 1 pound a week. For some folks, they drink enough soda every day that they're getting an easy 500 to 700 calories in their diet, just simply in drinks.
Where people live and shop for food contributes to the obesity epidemic. Low-income neighborhoods without grocery stores are called food deserts. Residents of food deserts often have nowhere to shop for food except convenience stores.
There's a substantial amount of research that shows that if it's a traditional convenience store that really only offers, processed foods, soda, chips, and nothing else, that the people in that area, that is their only option. So if a retailer or a convenience store can start to make concerted efforts to try to increase the variety of fresh and healthy food that's available at their retail location, that can translate to better choices in that community.
Tulsa-based Quick Trip convenience stores began stocking fresh fruit, yogurt, salads, and healthy sandwiches in all its locations about 3 years ago.
When we first brought out the sandwiches, our thought process was bigger is better, and it wasn't working. We had these huge sandwiches that were too big and people weren't going to buy them. And so you can see that we've reduced the sizes.
When portion sizes for healthy foods went down, sales went up. Thornbrew says customers are also starting to swap fountain sodas for tea and buying more portion sizes of 32 ounces or less. Plus, there's more demand for milk, juice, bottled water, and energy drinks. Dr. Kavanaugh says when people see someone else making healthy food or exercise choices, they're inclined to do the same.
We are individuals, but we still have a lot of that herd mentality about us, and we will follow the crowd.
Wetherill says eating more fresh fruit and vegetables is key to reducing obesity. The Supplemental Nutrition Program makes those affordable by letting low-income Oklahomans use SNAP cards to make purchases at farmers markets.
Chicken, carrots, watermelon.
Wetherill and Dr. Kavanaugh say reversing Oklahoma's obesity epidemic starts with the very young. According to the Centers for Disease Control, 17% of American children are obese, twice as many as a generation ago. A new study by the Pediatric Nutrition Surveillance System found obesity rates among low-income preschoolers dropped slightly in 19 of 40 states tracked from 2008 to 2011. 3 states saw a slight increase, while rates didn't go up or down in the rest. 10 states, including Oklahoma, were left out of the study because data wasn't contributed for each year and the state's methodology for collecting data changed during that time.
What's this that you have? Is that carrot? Did you raise that in your garden?
Yeah.
One preschool affiliated with Bartlesville's Smart Start program used its concern with childhood obesity to partner with the Washington County Master Gardeners this year to teach preschoolers to grow vegetables.
They're more inclined to taste vegetables that they've never tasted before because they see how they grow.
Changes in USDA guidelines are also putting more fruits and vegetables on school breakfast and lunch trays. 3 are offered each day at lunch, and children must have at least 1. Fruit portions will also increase from half a cup to a full cup by next year. Schools are also moving away from serving mostly processed eat-and-eat foods, says Tulsa Public Schools child nutritionist Michael Harp.
Incorporating more home-cooked foods, going to the brown rice, getting out of this chicken nugget, spaghetti, fried chicken ritual over and over and over again.
Wetherill says these are encouraging signs people are willing to make lifestyle and eating changes necessary to lose weight. She's also encouraged by federal and state programs that require healthier school menus and make it possible for low-income families to afford fresh fruits and vegetables.